All right, picture this. You're sitting at a restaurant, waiting for your partner, and they're 5 minutes late. Now, for most of us, this might trigger just a brief flash of annoyance, right? Maybe you check your watch, shoot them a quick text. But imagine if, in those exact same 5 minutes, your mind entirely rewrites the narrative of your relationship. You don't just feel annoyed, you feel an overwhelming, crushing certainty that they are abandoning you. You feel a massive surge of intense panic, which is quickly followed by profound anger. So when they finally walk through the door, super apologetic about hitting traffic, you don't feel relief. Instead, you spiral into a massive conflict. Suddenly, what was supposed to be a quiet dinner feels like your entire world is falling apart. Now, this isn't just a bad mood. This is a very real glimpse into what it's like to navigate daily life with a personality disorder.
Welcome to this explainer. Today, we're going to unpack the clinical reality behind these incredibly intense human behaviors. Because, it's so easy to just label someone as difficult or overly dramatic when we don't actually understand the mechanisms driving their actions. So our goal today is to look past the surface. We want to approach this topic with a really grounded, calm, and entirely non-judgmental lens. We're going to explore the neurobiology, the psychology, and the lived reality of personality disorders, stripping away the stigma so we can see the human beings underneath it all.
Okay, let's dive right into this. Section 1, the everyday roller coaster, when emotions escalate.
To bring it back to that opening restaurant scenario for a second, let's look at the broader concept at play here, which is emotional dysregulation. We all experience a huge spectrum of emotions every single day, but the way we process them and return to baseline, that's what defines our emotional health. A normal frustration means your partner is late, you feel annoyed, they apologize, your brain regulates that emotion, and you move right on to enjoying your appetizers. But with emotional dysregulation, the brain's alarm system is fundamentally hyperactive. It's stuck on high. That minor trigger of being just a few minutes late, it's interpreted as a catastrophic threat, a really profound fear of abandonment. The emotion doesn't just spike, it completely overrides rational thought, leading straight into spiraling conflict. And honestly, it is incredibly exhausting, not just for the person experiencing it, but for the people who love them too.
Moving along to Section 2, defining the clinical reality. What is a personality disorder?
To truly understand why this happens, we kind of have to zoom out from these daily life examples and look at the actual clinical psychology. Like, what exactly separates a difficult personality trait from a diagnosable disorder? Well, the definition here is key. A personality disorder is an enduring, inflexible pattern of behavior, cognition, and inner experience that deviates markedly from cultural expectations and causes significant distress. The absolutely crucial words here are enduring and inflexible. We are not talking about someone just having a bad day or going through a rough patch at work. We are talking about deeply ingrained, long-standing traits that remain super rigid across almost all personal and social situations, and they consistently cause deep impairment in how a person functions in the world.
And this brilliantly illustrates the core of the diagnostic criteria from the DSM-5. It really comes down to significant impairments in two main areas. First, self-functioning, meaning how a person views their own identity and self-direction. And second, interpersonal functioning, which basically relates to their capacity for empathy and intimacy. So it's a fundamental disruption in how the individual relates to themselves and to literally everyone else around them.
Which brings us to Section 3, borderline personality disorder, or BPD, the emotional thermostat.
Think of your emotional regulation as a thermostat in your house. If the room gets a little warm, the AC kicks in to cool it down to a nice, comfortable 72 degrees. Well, for someone with borderline personality disorder, or BPD, that emotional thermostat is broken. It completely lacks a middle setting. It is only ever freezing cold or boiling hot. And this creates a pervasive pattern of instability. Because that internal thermostat is broken, their self-image is constantly shifting. One day they might feel incredibly confident and worthy, and the very next day feel completely empty and flawed. This instability bleeds directly into their relationships, leading to super intense, rapidly changing perceptions of the people who are closest to them.
In daily life, these traits create just a relentless roller coaster. A frantic fear of abandonment can actually cause them to alternate between idealizing a partner, thinking they are the absolute most perfect person in the world, to abruptly devaluing them over a minor perceived slight. And this is accompanied by profound feelings of emptiness and often impulsive, self-damaging behaviors that they use as desperate coping mechanisms to manage that severe emotional lability. It is a really painful, chaotic internal experience for them.
Let's move to Section 4, antisocial personality disorder, or ASPD, the broken empathy radar.
If BPD is a broken emotional thermostat, antisocial personality disorder, or ASPD, is a condition where the individual's empathy radar is severely impaired or even entirely broken. And ASPD doesn't just appear out of nowhere in adulthood. It has very clear developmental origins. In fact, a formal diagnosis at age 18 or older actually requires evidence of conduct disorder before the age of 15. This usually means a childhood history of aggression, serious rule violations, or destruction of property. So it's a lifelong trajectory where that pervasive disregard for the rights of others becomes deeply entrenched during their teenage years.
The diagnostic reality of ASPD involves traits like deceitfulness, manipulation for personal gain, impulsivity, irritability, and a really fundamental lack of remorse. It is incredibly important for us to view this impartially. This is a complex neurobiological and psychological condition. Research actually shows structural brain differences here, like reduced prefrontal gray matter, which heavily impacts decision-making and emotional regulation. So we're looking at a clinical impairment in the capacity to feel empathy or guilt. We're not simply making a moral judgment.
Next up, Section 5, the trap of OCPD, rigidity and control.
Now, what's really interesting about this slide is we're going to shift gears entirely to our third example, obsessive-compulsive personality disorder, or OCPD. To use another daily life analogy, imagine playing just a casual, friendly board game with your family, but treating it as if the rules carry literal life or death consequences. There's no room for flexibility, no room for just kicking back and having fun. It's about total, absolute adherence to the rules. OCPD is driven by a maladaptive perfectionism, specifically at the expense of flexibility. People with OCPD are so preoccupied with orderliness, lists, and rules that the actual major point of the activity is completely lost. They might miss a crucial deadline at work, for example, because they are endlessly formatting a document, completely unable to let it go until it meets their impossibly strict, rigid standards.
Now, it is absolutely vital to differentiate OCPD from the more commonly known OCD. They sound similar, sure, but they are very distinct clinical presentations. OCD is characterized by intrusive, unwanted thoughts or obsessions and repetitive compulsions performed to ease anxiety. OCPD, on the other hand, involves those inflexible personality traits we just talked about. The individual often doesn't even see their extreme perfectionism or workaholism as a problem. Actually, they usually believe their rigid way of doing things is the only correct way to do them.
And this rigidity comes with a really serious mental health burden. OCPD rarely exists in isolation. It frequently co-occurs with other disorders. Most alarmingly, there is an elevated suicide risk in individuals with OCPD, which is strongly mediated by severe co-occurring anxiety and depression. They just place immense, crushing pressure on themselves. Understanding these origins, which are often linked to parental over-control during childhood, really highlights why comprehensive assessments are so necessary to identify these hidden vulnerabilities.
All right, let's look at Section 6, Treatment, Hope, and Healing.
After covering all these heavy clinical realities, it's a super common misconception that personality disorders are just a life sentence of misery. But the truth is, these are dynamic, modifiable conditions. With the right evidence-based help, immense improvement and healing are absolutely possible. So the crucial point is dialectical behavior therapy, or DBT. This is the empirically supported gold standard, particularly for BPD. It doesn't just ask patients to miraculously feel better, it teaches concrete daily life skills. It starts with mindfulness, staying present rather than spiraling out. Distress tolerance teaches them how to survive a crisis without making it worse. Emotion regulation helps identify and manage intense feelings before they explode. And interpersonal effectiveness focuses on asking for what you need while maintaining self-respect and boundaries. It literally replaces those maladaptive behaviors with healthy coping mechanisms. But you know, healing doesn't just happen in a therapist's office. It happens in daily life. For the loved ones of those with personality disorders, your strategy really matters. Educate yourself so you can separate the symptoms from the person. Communicate using clear I statements to reduce defensiveness. And most importantly, set firm, healthy, compassionate boundaries to protect your own well-being and make sure you practice your own self-care. You cannot pour from an empty cup, right? Maintaining your own balance is essential if you want to support them in seeking professional help.
Empathy, early intervention, and structured care truly pave the way for profound personal growth. Navigating a relationship with someone who has a personality disorder is undoubtedly a complex journey. But when both partners really commit to understanding, when they apply patience and utilize the right clinical tools, it doesn't just stabilize the relationship, it can foster a deeply rewarding, incredibly resilient connection. With mutual respect, support, and understanding, healing is absolutely possible.
Thank you so much for joining me on this explainer today. Before we go, I want you to ask yourself this.
If we treated emotional dysregulation with the exact same urgency and lack of judgment as we do a physical injury, how many relationships could we save? I really hope this deep dive helped demystify the realities of personality disorders for you and offered some practical clarity. Thanks for watching. Please subscribe and drop a comment below. What topic should we cover next? See you next time.